You probably worry about your weight for two reasons: your appearance and your health. Besides affecting your self-esteem, being overweight or obese increases your risk of developing type 2 diabetes, heart disease, cancer, and other health conditions. At the other extreme, being underweight may cause low blood pressure, heart palpitations, osteoporosis, kidney stones, and other issues. It may surprise you to learn that body weight can impact reproductive health as well. In addition to conception and pregnancy problems, weight loss and weight gain can both significantly affect your menstrual cycle. The effects of estrogen. A woman's ovaries produce the female sex hormones progesterone and estrogen, after getting certain cues from the pituitary gland and the hypothalamus. Estrogen helps build the cushiony uterine lining, known as the endometrium, that will nourish a fertilized egg. If fertilization doesn't take place, a woman's body naturally sheds that lining through the process commonly called having a period or menstruation. Every woman's menstrual cycle is slightly different, but over time, most women's cycles fall somewhere between 21 and 35 days. The weighty side of the menstrual cycle. The biology is simple: basic cholesterol compounds in fat cells can get changed into a type of weak estrogen called estrone. Overweight or obese women carrying extra fat cells have little estrone-making factories, which have an estrogenic effect on glands, explains Maria Arias, MD, a gynecologist at Atlanta Women's Specialists in Georgia. This added estrogen can cause bleeding or menstrual disorders. A woman may go months without ovulating, for example, but the uterine lining is still accumulating, to the point that it becomes unstable. Eventually, says Dr. Arias, a woman can have a period that lets loose like a floodgate, with prolonged or very heavy bleeding. Overweight women aren't the only ones who may have problems with their periods. Underweight women and women with eating disorders, like anorexia nervosa, that result in extreme weight loss may also be unintentionally impacting their menstrual cycles. Women without much fat on their bodies may have fewer periods or go longer without ovulating. Starvation, as well as extreme exercise and stress, can trigger an effect that suppresses the hypothalamus. These women may be so underweight that their bodies simply stop making estrogen. Additionally, the lack of fat doesn't allow cells to convert cholesterol into extra estrogen.